Proper nutrition is essential to maintaining our body's health, growth, and ability to heal. Various medical conditions can make it difficult or impossible for a person to receive the nutrition they need by mouth. In these cases, a gastrostomy tube is inserted to supply direct access to the stomach for feeding. At Applied Medical Technology, we recognize the need for a convenient and effective means for delivering nutritional formulas into the body. With over 20 years of experience in the medical device field, Applied Medical Technology is a worldwide leader in the design and development of low-profile feeding devices. The AMT MiniButton is a silicone replacement device that is inserted into an existing gastrostomy to enable feeding, decompression or venting, and administration of the medications directly into the stomach. Its low-profile design is comfortable and allows the patient greater mobility. The MiniButton comes with a 10 cc luer tip syringe, a bolus feeding set, a right angle feeding set, and a 60 cc catheter tip syringe. Every MiniButton comes with a caregiver's reference guide as well, containing detailed information about the MiniButton. Please be sure to familiarize yourself with it. Let us begin by looking at the parts of the MiniButton and what they do. The external base maintains tube position at the patient's skin level. A properly fitted device should not fit tightly against the skin. A 3 mm gap between the external base and the skin surface is recommended to provide room for air circulation and cleaning of the stoma site. The feeding port allows access to the stomach for feeding, decompression or venting, and administration of medications. It should remain sealed with the safety plug when the device is not being used. The anti-reflux valve, located in the bottom of the feeding port, prevents stomach contents from leaking out of the tube. The valve is opened when a feeding set adapter is inserted. The silicone retention bolster is located at the end of the button and holds the tube in place. It has been designed to be very soft and comfortable. Now let's look at what is included with your MiniButton. It includes two types of feeding sets. The 12-inch bolus feeding set with single port is intended for short duration feeding. The 24-inch right angle feeding set is used for continuous feeding. Your doctor can advise which feeding set best fits your needs. The kit also includes a 60 cc syringe that fits into the bolus port of the bolus feeding set and the feeding port of the right angle feeding set. The syringe can be used for bolus feeding, administering medications, and flushing the MiniButton and feeding sets with warm water. As for the 10 cc luer tip syringe included in the kit, it can be used for administering small dosages directly into the feeding port. Feeding sets should be replaced every 2 to 3 weeks and can be obtained through your care provider.